Hello friends, I am Dr.Laxman Salve, consultant proctologist and general surgeon practicing in Mumbai. So this is a Constipation Awareness Month. Constipation is a very common problem and it is increasing day by day. I will say it is so common that at least one member in a family must be suffering with constipation. Though it is less common in India as compared to Western countries, but it's still becoming a big major hazard in our day-to-day life. So I would like to briefly summarize something about constipation and give you some common guidelines which can help you in reducing your constipation or to have a good healthy lifestyle. Now constipation is defined as if the person is not having frequent bowel movements or he is passing hard stools, it is called as constipation. So if you go by American literature, if a person doesn't pass motion at least 3 times in a week, they call it as constipation. But in Indian situation, if we say even if he doesn't pass more than 5 times in a week, then it is called as constipation. So this is about frequency. The other thing to call it as constipation is the consistency of the stool. So there is a classification called as Bristol classification for stool, which ranges from 1 to 7, 1 being the hard stool and the 7 being the very low stool. So a person who is having constipation or the stool which is from classification 1 to 3 is called as he is passing hard stool, and that means he is having hard stools. So in Indian situation, if we see, most common complaint in Indian public is they are having feeling of incomplete evacuation, and they feel that their abdomen is bloated, and they feel that they need to push stool in the morning often to evacuate and feel comfortable. They feel bloating, and then they say they are having constipation, and these things raise multiple problems. So if we see why this constipation happens, there are multiple reasons. We are fortunate enough to have adequate fiber in Indian diet than Western people, and that is why constipation used to be less in Indian population, but now it is increasing. So here I want to say that main reason for constipation is diet. If the diet is not rich in fiber, and at the same time if it is lacking water, then people get constipated. But this is one of the important reason, but there are many reasons why people get constipated. So I told you about one person in a family is having constipation in India. So if we say as of total Indian population, about 40% of the people do have constipation. 18% of the population do complain that they have straining at stools, and 23% people say they have incomplete evacuation of the stools. Females are more prone than males, and constipation also is common in extremes of age, that is in early childhood and geriatric population. So if we consider etiology, why this happens, I'll come one by one. So if you consider pediatric population like children, so there are many reasons why children have constipation. I do come across lot of children patients who come to me with constipation and it's not getting relieved. So going to their habits of daily routine activity, and if we go to their toilet habits, we need to check with the parents what time do they go for toilet. Most of the time children try to postpone their motion. If they are going to the school in the morning, they usually don't go to the toilet in the morning and go to the school, and then they feel like going for motion, and they're in the school because of the fear of the teachers or colleagues, they try to postpone the motion, and then they get habituated to postponing of the motion, and then they feel constipated most of the time. So we as a parent has to teach children to go to the motion, to make the child go to the motion in the toilet in the morning before they go to the school. Now the other thing is, they should see to it that the children are sitting properly in the toilet. If they are sitting in an uncomfortable situation, uncomfortable position, then they may not evacuate bowel properly. So if it is an Indian toilet, since the foot, the place where the feet are placed, that is quite away for them, and they are not able to sit properly. So we have to see to it that they are sitting in a proper position when they go to toilet. Another thing, if they are using English toilet, the acute angle is not formed, because of which they are not able to evacuate out. So Indian toilets are always preferred over English toilets. Other thing is that children do take lot of bakery products like biscuits and other bread, pav, all those things. And these bakery products are very harmful. So they should avoid taking bakery products. Parents strictly has to see that they are not taking any of these. At the same time, water intake has to be good, and they should eat lot of leafy vegetables, and basically vegetables, fruits, citrus frutiles specifically should be eaten or given to the children by the parents. Then they will, most of the time children do improve in their constipation. Now coming to females have 3 outlets in the perineum as against male who has 2 outlets, and that is why female pelvis is a weak pelvis, and that is after pregnancy or during pregnancy, the pelvis becomes weak, the pelvic floor becomes weak, and the females land up into constipation. So what is required here is, those females, and for that matter males also, should do proper pelvic floor exercises. They may be, pregnant or non-pregnant ladies, before pregnancy, after pregnancy, proper pelvic floor exercises are must. And at the same time, other things like eating leafy vegetables, fruits, should take high fiber diet and avoid low fiber intake, that is avoid bakery products and maida products and junk food. These are also applicable. So coming to males, most of the times male get constipated because they are eating spicy foods, and which causes lot of bloating, and at the same time they may be eating a lot of junk food, and then they suffer with constipation. So they should avoid all this and should increase water intake. And especially males, if they are going for gym or exercises, they tend to lose water. They should replace water more when they are going for gym and exercises. If the people are sitting in ACs in the office, they tend to get less thirsty, and then they drink less water, and then these people should also improve their water intake. So these are usual. And in elderly, the reason for constipation in elderly is something different. Their bowel of the elderly people is having slow transit most of the times. So what happens, bowel is supposed to have good peristalsis and propel the food or the fecal matter ahead in a right speed. But if this doesn't happen, like in elderly people, especially in females, they tend to get slow transit constipation. We call it as slow transit constipation. And the next entity where people get constipation is something called as mechanical obstruction, or something there is something obstruction which is causing these people to pass on motion, and that we call it as obstructive defecation syndrome, where the bowel enters into the bowel right in the rectum, and when patient tries to evacuate out, instead of passing stool, the bowel only enters into the bowel, and the stool gets impacted or retained in one of the pocket, and they are not able to evacuate it out. So this is another entity. So we'll deal with all these entities one by one. So whatever I have described now, these are all primary. These come all under group of constipation called as primary constipation. So there is secondary constipation. Secondary constipation usually is related to the organic diseases, systemic diseases, and if the patient is taking medications like psychiatric medications or any other medicines which may cause constipation. If the person is having thyroid problems, then they are also they also tend to get constipated. So as I told you, to summarize, female gender is more common, age more than 35 years, non-vegetarian food more than vegetarian food. So here I won't say that non-vegetarian food should be avoided, but you should take enough salad along with the non-vegetarian food, and the quantity of non-veg should be smaller. Another commonly faced problem is constipation secondary to not having proper posture in the toilet. So Indian type of toilet is supposed to be a good toilet, where the person is sitting in on both his legs in such a way that the rectum gets opened up in an angle. The angle of the rectum becomes wide enough for easy passage of the stools. But in English type of toilet, that angle doesn't get open up, and that is why proper sitting posture is important, and Indian toilet is always preferable, especially for those people who does have constipation. They should try to go for Indian toilet rather than English toilet. So this was normal transit constipation. So next is slow transit constipation. Now here what happens, the patient typically says that he doesn't get urge to pass motion. So in slow transit constipation, patient does get urge whenever there is stool. So stool is not getting formed in slow transit constipation, or they are not able to evacuate it out. But slow transit constipation, patient says that they don't get urge only. They don't feel like going for motion, and then they feel little bit bloating and discomfort in the abdomen, and then they sometimes pass stool in once in 2 days or 3 days also, and then they feel uncomfortable. So this is slow transit constipation. Another form of constipation is where there is a defecatory disorder. There is something in the rectum where people are not able to push the stool out. That is called as obstructive defecation syndrome, where the rectum enters into the rectum and people are not able to pass the motion out, and then the stool gets impacted in the one of the pouch formed in the rectal area, and these people need to put their finger inside or do some manipulation in such a way that they will be able to pass out the stools easily. So sometimes female may put their finger into the vagina and push the stool from the front side so that they can evacuate it out. Sometimes these females spend a lot of time, about half an hour, 45 minutes in toilet, but they are not comfortable in evacuating out the stool, and they feel uncomfortable, and they again deteriorate their problem by sitting in the toilet for longer duration, and then they improve, they deteriorate in the sense that they are pushing the bowel into the bowel, and then condition further deteriorates than improving. And in such patients we need to go for something called as surgery, called as obstructive, something called as star surgery. And that surgery is called as star surgery because it is a stapled stapled transanal rectal resection. So here what we do is we are taking out the portion of the rectum which is forming pouch on the front and back side, and then after removing that pouch, the rectum gets aligned, and then they are able to pass out the stool easily. So when patient comes to us, what we need to do, we have to see which group they are fitting into. When we do examination, we need to see that whether they are able to evacuate it out, or there is something dyssynergistic movement, like whenever the patient needs to pass the stool, they are, on the contrary, they are contracting the anal area rather than pushing it out. So this is very common that those females, especially those females, when they are asked to push if we pass a finger inside and ask them to push the finger out, or when in some special investigation we call it manometry, where we pass a balloon and then we ask them to push the balloon outside, they are not able to throw it out. That means there is some dyssynergia between the contraction of the pelvic floor muscles, whereby they are not able to throw out the fecal ball. And these patients need to go for something called as biofeedback, which is a physiotherapy type of exercises where we teach them that how to evacuate that fecal matter out, and that is taught, and most of the problems get sorted out. So if they don't improve with this, then only we go for surgery. And in that surgery, whatever I have described last few minutes back, that we do that surgery, and that rectum becomes aligned and the patient becomes comfortable. Now this comfort is also we say about 60% relief patient gets, but a person who is sitting for a longer time, maybe around 40 minutes or half an hour, if he gets 60% improvement, he is quite comfortable. So we need to see this kind of patients, evaluate them, and then we suggest them surgery. So this is the total management for constipation. Most of the time it is conservative management. Surgical management is limited to few diseases, and that is also we have to exclude other problems, and we have to see that they are improving with the we have to see to it that they will improve with the conservative management, like some medications only, and then if they are not improving with their consent, we go for surgery, and then they can get improved. So to take home message, and other thing is, whatever medicines which we give is different kinds of laxatives. So what does laxative do is some laxatives are osmotic laxatives, some are stimulant laxatives, some are bulk forming laxative, or stool softeners are there. So stimulant laxatives, what they do is they stimulate peristalsis and stimulate secretion of the fluid into the bowel, and that is why the patient goes for motion. Bulk forming laxatives form a bulk in the stool, bulk in the rectum, and then they absorb some water, and that is why the patient feels going for motion. And other form of laxative is osmotic laxative, where where by the presence of the medicine in the bowel, the water osmosis happens and the good quantity of stool forms without having stimulant effect on the bowel, and then patient passes motion. So these are different kinds of laxative. A doctor, a coloproctologist, has to see what kind of laxative his patient needs as per his requirements. And this is how we treat the constipation. But to take home message for treatment and management of the constipation is, the people should improve their dietary habits. Now, what dietary habits is most important? Water intake. So around 2.5 to 3 liter of water for an average about 75 kg weight person. Around 2.5 to 3 liter of water daily. It should be completely water. It doesn't include any other drinks. The water intake should be more. High fiber diet, that is the fruits, vegetables, salad should be included in the diet. We have in our Indian culture jwari, bajri, maca. These they contain lot of fiber. So roti of jwari chi bhakri, bajri chi bhakri, these things should be included in the diet. You can have good amount of, some people get good amount of motion only if they eat rice. So rice is also okay. Wheat is also okay, but you should avoid white flour, that is maida, and that maida is usually used in bakery products, that is bread, pav, biscuits, khari and all those things. They should avoid junk food, that is burger, pizza and other things. Other thing is cold drinks. Cold drinks are very harmful to the body, very harmful to the bowel. The cold drinks should be avoided, like Coca-Cola, Thumbs Up and whatnot. Anything in that group is not good. So these things should be avoided. So what should be taken? So the intake of curd, buttermilk, cow ghee should be included. Fermented food like idli, dosa, uttappa, these are good things to eat, but these all things should be associated with less of spices. So usually people get Indian situation, usually people get bloating more, gas formation is more, and that happens because of the intake of the spicy food more. So spices are good, that's good, but the quantity of the spices should be very less. Whenever you cross that less mark, and nobody knows when they cross, it's individual. They should understand themselves, like where to stop those spices intake. And if the spices intake is more, then they'll end up into formation of gas and bloating, and then constipation, and then burning in the anal area while passing motion. So spices should be reduced, and they can take some chili. Mirchi chalta hai, lekin spices nahi chalega. So they can take some chili, but spices should be avoided. Like we call it as garam masala or whatever, those things. So gravy items should be limited, or they should not be taken. Other thing is sugar. Sugar looks not very harmful, or it's very much liked by many people, but sugar is also very harmful to the body, and it also does add to the formation of constipation. So sugar should be avoided. Sugar harms some or the other part of the body always, maybe today, tomorrow, or in the long run, but sugar will definitely harm you sometime or the other. So as far as possible, if it is possible, avoid sugar intake as much as possible, and if it is not, then limit sugar intake. This sugar intake should be reduced, spices intake should be reduced, and the other thing is salt, though not related with the constipation directly, it is used mainly in formation of junk food. that is why salt also I usually say to avoid people. I ask people to avoid salt intake also. So again, other things are like preservative packaged food is very much in boom nowadays. People go fast food. People like to use preservative food and packaged food for their daily routine food intake. But these are very harmful because they contain preservatives and they add to your constipation. So these are the dietary instructions which I'll give for managing the constipation. And the other things are equally important are exercise. If you walk in a good steps, good number of steps, or you do any exercise for about half an hour or 20 minutes also, that is sufficient to avoid your constipation. That although at the same time that improves your pelvic floor muscles and gives good evacuation capacity, especially in the females. And other thing is good sleep. Good sleep is also important to avoid constipation. So to have healthy lifestyle is the crux to avoid constipation. I wish you all a very healthy and happy foodie life, because most of the diseases happen because of the food which you take. And if this food is not proper, and if the food is constipating, your whole of the system gets hampered. It disturbs your brain, it disturbs your daily routine activity, it hampers your decision making capacity, it makes you uncomfortable, it makes you feel something irritated. And that is why I always tell you should eat healthy food. And what healthy food is, just I have described it. So so if you want to have a good healthy and happy life, reduce your food intake to whatever is required, drink a lot of water, and high fiber diet. I wish you very happy and healthy bowel life, and that's all. Thank you very much.